Now let's talk about options for denture wearers. In fact, the two categories. You've got one category where people with really bad teeth, you cannot save them. Full mouth of extractions, but they don't want dentures. Then the other group are the actual denture wearers. So if they go to your practice, if everything works out right, what are their options?
So there are basically two categories. One is a snap-in, snap-on dentures. So what we do is we place about 2 to 4 dental implants on the lower jaw and 4 to 6 implants on the top, and we secure the denture in place. It still comes in and out, but you don't have to use any adhesive, no denture glue. Okay.
And that's about half the cost.
Yes.
Of the other options.
That's about half the cost than getting fixed teeth in the mouth, but it works pretty much similar. The only thing is it still comes in and out, so you can maintain them, and you can eat the food you like. So this is also a lesser cost alternative compared to the places which only give you one option. You don't have any other option where you only get fixed teeth. But now with snap-in, snap-on dentures, you have the option of getting it done at less than half the cost than what a fixed tooth would cost.
So these other places don't offer the snap-in, snap-out.
I think it's terrible. Yes, I think it's terrible because that option should always be given to the patient, because not everyone can afford to get fixed teeth in mouth. They work great, but this is an option which would possibly fit their budget, and they can get it done. The second option, of course, is to get fixed teeth.
Yeah, how many implants for that?
So on the top, it's same 4 to 6 implants. On the bottom, we do 4, 6 implants on the bottom. The teeth are secured in place.
And they get a full arch of teeth on the upper and
lower. Full arch of teeth, top, bottom, which functions just like your natural teeth.
And they can eat whatever they want.
They can eat
whatever. Literally, like nuts?
They can eat nuts, they can eat corn on the cob, they can eat apple. The same day we give the teeth.
Do they ever call you and say, "Doctor, are you sure I can eat, corn, or are you sure I could do this?"
All the time. So now what we do is when we deliver this teeth, we actually make them bite into an apple, so they believe that it is true. Because I had a patient who did not eat hard foods 3 months after I gave the fixed teeth to her, and because she was afraid. She wore dentures all for 20 years, and she could not eat hard food with that, so she could not believe that she can eat hard food. So she called 3 months later. Can I eat hard foods now? So that told me that I have to tell my patients that they can start eating the same day.
Now, when they're in your office and they're biting into that apple for the first time, are they scared?
They are. They're absolutely scared because they don't believe that it's going to happen. But when they do it, then they believe it. When they know that they can bite into an apple without the denture falling out from the back, they know that they can eat hard foods. And that is exactly why we do it. We have them bite into an apple while they're in the office.